Hi, I'm Ivan with InfectED, and joined by me today is Dr. Trahern Jones. He received his medical degree at the Mayo Medical School, and he completed his pediatrics residency training at the University of Arizona, and followed up with a subspecialty fellowship at the University of Utah. Dr. Jones, thanks for being with us today. Really appreciate it. All right, so just to start out, at what point in your life did you develop an interest in pursuing medicine?
Looking back on when I first got interested in medicine, to be honest, when I was in high school, I was never interested in medicine. I was not interested in that kind of career. I got D's and F's when I was in high school, and it wasn't until later on where I started just taking more biology classes in college where I started saying, hey, this is something I could actually do. It was sort of a process of discovery for me. And then what really got me interested was I did a volunteer trip where we went to India and we worked alongside college students from South India where we worked to bring some HIV education to local communities. These were nonprofits focused on in slums, focused in schools, and I learned a lot about diseases of poverty, socioeconomic inequalities, global health. It got me really passionate and interested in medicine, and that's ultimately kind of what really tipped me forward into pushing for building my application for med school.
So you applied to medical school and you got in, and obviously we all know med school is pretty tough. What made you want to specialize in pediatrics and later on infectious diseases?
Yeah, it's a great question. So when I first went into med school, I was more interested in infectious diseases already because I'd had that background working with HIV populations, HIV education, global health. So I already knew I enjoyed infectious diseases, but I kind of sampled a bunch of different things in med school. The way med school is structured, they actually have you rotate between a bunch of different areas of medicine. So these are your 4 weeks in surgery, and these are your 4 weeks with obstetrics, and then these are your 4 weeks with pediatrics. I never really saw myself as a warm and fuzzy pediatrician Patch Adams type of guy. That was never who I really saw myself as. Although I certainly enjoyed working with kids, I thought they were great. I just didn't think I was that kind of personality. But when I actually did my pediatrics rotation in med school, my wife, or she was my girlfriend at the time, my wife now, she observed, hey, this is the first time you've come home in a good mood consistently every single day from this rotation. Because that was not true for things like neurology and psychiatry and internal medicine. And that's when I had the realization that I really enjoyed pediatrics. I loved working with families, working with everybody from babies to children to teenagers, people with all kinds of complex conditions, or people who were totally healthy and then are having just kind of a run-in with the first serious illness of their life. I really got very passionate about it, and I loved it, and I still do.
Mm-hmm. So, adding on to that, what does a typical day on call look like for you?
So, to kind of summarize a day in the life of an infectious disease specialist, I'll just kind of describe my day so far. So, I woke up early this morning at 4 a.m., had some breakfast, drank some coffee, looked over some patient charts from the day before. I got out around 5:30 to the climbing gym. I spent some time on the bouldering walls, did a few hangboard exercises, came back home, looked over some more charts, sent some emails about some patients who are really sick and I need some advice on from national experts. And then I got my daughter up and got her to school, drove into work, looked over some more patient charts. And then we started seeing our patients. So we started out seeing some individuals like I have a little baby girl who's got a knee that is fully infected with bacteria and full of pus. We had to get some orthopedic surgeons to open that knee up and drain it out for us and pick the right antibiotics to treat that bacteria. I have a young lady who has a disseminated infection with a fungus that only lives in the southwestern part of the United States.
Wow.
And required some expertise not only from our team, who's a little more familiar with this and the antifungals we use to treat it, but I had to email people who are national experts on that specific fungus to get their advice on it and how we're going to best treat it. Moving on, we had to see a young man who he had a heart infection where the bacteria was actually on the inside of his heart, on the valves itself. We had to choose the right antibiotics for that. Then later on in the day, we got a phone call about a young man who has some kind of infection going on in his brain, and we haven't figured that out yet. And right now, it's a struggle between us and the neurosurgeons and the neurologists to figure out what is our best way to actually get some kind of sample or specimen to determine what is this mystery illness that's giving him his symptoms. And that ate up a lot of my afternoon too. I had another young guy who he has hemophilia, which is a condition where you need to have transfusions of certain clotting factors, on a regular basis. And he has this central line in place to help him with that. That got infected with a staph bacteria. And so part of what I had to do was help the ICU team decide if they had to pull that out on an urgent, or rather an emergent basis, because it was literally killing him with the bacteria that it was shedding into his bloodstream. All in the meantime, me and my team members are taking phone calls on other patients in the hospital. Hey, what antibiotics do you think are a good idea for this? What test is best for that? And then we also even field calls from all over the Intermountain West, literally everywhere from Wyoming, Idaho, all of Utah, parts of Montana, parts of Nevada, and even sometimes northern Arizona as well. So, we try to serve this whole huge community that we work in, and it keeps you on your feet. It's a little bit of an endurance sport, but it's incredibly energizing. There's some really cool stuff we get to see and help out with. And honestly, there's nothing like seeing a kid walk out of the hospital, when 3 weeks before you saw him rolling in on a gurney. It's amazing to see the changes and the way that kids get better when you're dealing with these kinds of infections.
That's amazing. What steps should high schoolers be taking at this point, and as they go into their undergrad, as they prepare for medical school?
So steps that I'd encourage anybody in high school to undertake would be, don't be like me. Focus on your studies, work hard, get your homework done. But you don't have to have an absolute perfect 4.0 GPA in high school to wind up becoming a doctor one day. All you need to be is somebody who's honest with themselves, who's interested in the world, who's curious, and who looks into their passions and pursues them. Those are the most important things for anybody in high school to be doing. Build up yourself, learn who you are as an individual, go through some self-discovery. All of that's actually really crucial and really important. Don't forget to do fun things too. I look back on a lot of the things I did. I worked really hard in college, and it did help me get to where I was, but there were also times where I could have absolutely spent more time going on road trips or, spending more time with friends and things like that. Because self-discovery is a really important part of actually gaining the confidence and gaining the insight that you need to decide on what's going to be your career going forward in the future. Then after you've kind of, built up some confidence, built up who you are as an individual, it's really important to kind of continue to advocate for yourself. So regardless of whatever your path is going to be into whatever your future career is, and not everybody who's a doctor goes straight into doing like really hardcore chemistry in college, or really, complex molecular biology. There are lots of people who are art majors in college, people who are English majors. My division chief, my boss, he was an English major in college. And then he just took some of the extra courses you need to get into med school. So it's really important to just pursue your passions is what's most important. And to ultimately kind of advocate for yourself, to say you believe in yourself and that you think you are deserving of, moving forward in that career path. Those are all really important things to bear in mind.
Absolutely. With the current events going on in the last couple of years, I imagine your job got a whole lot busier. What has the COVID-19 pandemic shown about our pandemic preparedness as a country and as a global community?
Yeah, what was really tough to see as a pediatric, or just as any infectious disease doctor, anybody interested in public health, was how poorly prepared we really were. Our public health departments were seriously underfunded and understaffed. They've been having their budgets cut for years. Our actual governmental structures to handle something like what is truly, in all honesty, a biological emergency, they're not there. And on top of that, our leadership is really badly educated and prepared for something that requires a little bit more understanding. The number of people in Congress who have science backgrounds is astonishingly low. The number of people in Congress who have medical backgrounds is also astonishingly low. And that's just Congress, but there's many more people who are state governors, who are mayors, who are, in all kinds of different levels of government, who have virtually no background in science. And so it's really hard for them to grasp, what the nature of the emergency was when this pandemic broke out. And the scariest part about this is this is not the last pandemic you're ever going to see. There will be another respiratory virus. There can be another flu-like illness. There will be something else that comes along. And hopefully we learn some lessons from this one.
Mm-hmm. Leading right into my next question, what are, if any, the positive outcomes that have come from the COVID-19 pandemic in regards to future ones?
Yeah, so I think sometimes we do focus a little bit too much on, the things that disappointed us with the COVID-19 pandemic, the failures of government, the underfunded public health structure. But there were also some really amazing things that came out of it as well. Every time we complain about people who refuse to, help out their community by just wearing a simple mask, or refuse to help out their community by getting a simple vaccine. Think of the many millions more people who did that, and were not being singled out, and we're forgetting how much work everybody was putting into trying to keep their communities safe. We're forgetting how much healthcare workers put into their jobs, poured their lives into their jobs. Some literally lost their lives in the pandemic trying to help take care of their patients. They're heroes for doing that. So those were the things that I really, took away as, hopeful from this pandemic, was that actually quite a few people rose to meet the challenge. It's just, we tend to focus on the negative more than we focus on the positive.
Absolutely. And you obviously had a close call personally in your own personal life with your father. How is that, being so educated in infectious diseases and not really being able to do too much for your father at that time?
It was really hard because obviously, being trained in infectious diseases, I was taking this pandemic very seriously. I'd seen children who had suffered from COVID-19, and then I'd also volunteered in the adult hospital to help take care of adult patients who were sick with COVID-19. So I'd seen how awful it can be. And I had some disagreements with my father about it. And he really didn't believe that he was at risk. He did not get vaccinated. He didn't enjoy wearing a mask, and tried to blow it all off. And he got terribly ill. So it almost killed him. And he was, in an ICU for a period of time because of that. What was interesting was to talk with him again about that, and to kind of go through that process of us coming to terms with our two different viewpoints on this, and seeing the kind of change in our personalities that went through it and the healing that happened afterwards. Those were really significant to me. In the end, you could be trained in a specific area and think you're the smartest guy in the room about it, but that doesn't matter at all if you're not reaching the people that you love and you care about. And that's what it really taught me, was how important it is to be sharing the information that we have, but to also be understanding where other people are coming from, or why they may be hesitant to believe that information as well. That was what was really important to me about that whole episode.
And we're glad he's doing better.
Yeah, he's doing great now. He's hitting the gym every day.
Dr. Jones, you alluded to previously that funding's gone down, and support for infectious disease programs in the U.S. has been constantly reduced. Why is infectious diseases not a commonly sought out specialty, despite infectious diseases like malaria, tuberculosis, and HIV/AIDS still remaining in the WHO's top 10 for causes of death in the world?
Yeah, infectious diseases are still a huge problem around the world, as well as in the United States too. And a big part of why it's lost a lot of funding over the years is that it's one of the least profitable areas of medicine. So for pharmaceutical companies looking to come out with their next big blockbuster drug, it's not typically an antibiotic. It's not typically an antimalarial. There's not a ton of money to be made in those sectors. Instead, it's usually medications related to non-communicable diseases, to cancer treatment, to biologics for things like autoimmune diseases. They tend to focus a lot of their energies over there. And you do hear about new drugs coming out all the time, constantly, about these different areas of medicine. And of course they're worthwhile, and of course we need those. Those people need these medications. But we also desperately need more antibiotics. We really badly need new antimalarials. We need basically drugs in every category of infectious diseases. But that's just not where the pharmaceutical companies tend to make their profits. Likewise, in terms of training to become an infectious disease doctor, for example, we're actually one of the lowest paid kinds of doctors there are in medicine. We're down at the very bottom. And that's not saying that I'm begging on a street corner or anything like that. We're still certainly okay, when you look at the median American income. But compared to somebody who is a dermatologist, a skin doctor, or an ophthalmologist, or an orthopedic surgeon, all these other fields of medicine, they do tend to make quite a bit more. Not saying that people go into specialties for selfish reasons, but there are a lot of unconscious reasons why people do kind of get led into different specialties. So for example, I have almost $200,000 of debt from medical school alone. That's me. And I went to a med school that actually helped pay for some of my schooling. Wow. There are others who go to school and they're in $300,000, $400,000, and even $500,000 of debt. It's very hard to turn away from specialties that can help you pay off that debt relatively quicker than specialties who they need more of you, but they're not necessarily going to be able to pay that debt off very quickly. And so that's why there's also some pressure going on from an economic sense against people going into the infectious disease field. I like to say, though, that because of that, if you ever meet an infectious disease doctor, you know they went into it because they really love it.
Where can high school and college students who are curious about infectious diseases go to learn more about the specialty?
Where can somebody who is early in undergrad or in high school, where can they look for more information if they are interested in something like infectious diseases? I would encourage them to totally reach out to, if they know anybody in infectious diseases or if they can find anybody in infectious diseases, please ask us. I think a lot of us are really passionate about it and would love to share, why we love this job. But there are websites like through Infectious Disease Society of America and Pediatric Infectious Disease Society who have some more information on this. But I'd love to craft more of a clearinghouse of information, really targeted more towards people in high school and undergrad, explaining why this is such a cool field, who we work with and what we do, and why this is an interesting area to work in and how to prepare yourself for it. So I think that'll be a project in progress for us.
Yeah, as you said it yourself, that's one of our goals here at InfectED, to increase awareness and interest in infectious diseases and the amazing people who work in that field.
Like me.
Yeah. TW, Dr. Jones, thank you so much for your time and for being such an amazing mentor for us here at InfectED.
Absolutely. It's been a pleasure. Thank you so much for having me.